Can diabetes affect the eyes? Yes, this used to be a very commonly asked question many years back. Now many people know that yes, diabetes can affect the eyes. But not many people know how it can affect the eyes, how to take care, and how to protect the eyes, and how to prevent these changes or the damages. Before telling all these things, let me tell you one statement which is taught to us and repeated. Our professor used to say, always remember, diabetes can cause blindness, diabetes can cause blindness, and it is preventable. What a powerful statement. Even now, after so many decades, it rings in our ears what our professors used to tell. In spite of so much of advances, in spite of so much of awareness, many people come to eye doctors very late. So now, in that regard, this is a small effort to educate people as to what can happen and how one can protect the eyes. Diabetes can affect nearly all parts of the eye. Can it cause glaucoma? Many glaucoma patients also have associated diabetes, and it is more prevalent in diabetic patients. So whether it will cause glaucoma is difficult to say, but for all those who are having diabetes, it's a risk factor and we check for glaucoma also. Can it cause cataracts? Yes. Diabetic patients are more likely to have early cataract formation. Cataract is an age-related condition. It doesn't have to come because of diabetes, but in diabetic patients we see early. So it is also contributing in a way. Diabetic patients, diabetes, can it affect the eyelids? Yes. Many of them we see coming with repeated eyelid infections. So it affects the eyelids, it affects the eye pressure related issue, it affects the cataract related issue. Can it affect the optic nerve? Yes, it can affect the optic nerve. Many patients with diabetes come with ischemic optic neuropathies or other optic nerve problems. Can it affect the eye movement? Yes, it can affect. Many patients we see having squint or double vision arising out of what is called as mononeuropathy associated with diabetes. Then there is one more thing, and which is more common and more important. It can affect the retina, and it's called as diabetic retinopathy. I came to that last, though that's more common, more contributing to the loss of vision, because it is important to know it can affect other parts of the eye also, and it's a disease which has to be watched for. Many other things are little not so concerning with regard to vision. They can be treated, handled, but when it comes to diabetic retinopathy, optic nerve related issues, it is quite a serious one with regard to vision. What is it does do in retina? Retina has fine vasculature, the blood supply, and these blood vessels, the health of the blood vessels get affected in diabetes. When it affects the blood vessels, the supply to the area will be reduced, and the blood vessels themselves become a kind of leaky, and there could be small hemorrhages, and the areas which are not getting enough nourishment in the retina, that's the inner layer of the eye. The areas that are not getting enough nourishment may function little less or may not function at all. And these areas which are having less blood supply start producing some chemicals, they become some chemical factories, and they invite new blood vessel formation, which themselves are unfit in terms of their integrity, in terms of their strength, and they can break and bleed, causing sudden loss of vision, and so many things. So, it is very important for all diabetic patients to have good control of blood sugars. Thereby, their blood vessel health is maintained, good control of blood sugars, and keep a watch on creatine and blood urea, so that those things become other contributory factors. Keep their blood pressures under control, and also have periodic eye checkups. What is this periodic eye checkup? We suggest for everybody who is diagnosed with diabetes to have their first eye checkup at the time of diagnosis. Many a times when diabetes is diagnosed, we do not know whether it has just started or it was there for so many months or years before the time of diagnosis. It's difficult to put a timeline there, and hence anybody who is diagnosed with diabetes must have a preliminary screening eye test. When a person comes with this, they should come and specifically tell the eye doctor that they have been diagnosed with diabetes and they would like to know about the health of their eye with respect to diabetes. Sometimes patients do not tell us whether they are having diabetes or not. We have to prod and ask. When we prod and ask, they say, sometimes yes, it's borderline, this kind. No, don't have any ambiguity. Tell them what it is so that your doctor will be able to help you well. During the examination, doctor does, apart from vision test and other various tests, he will also do a slit lamp examination, that is to see your eye under high magnification, and also he will see the inner parts of the eye called retina by doing what is called as indirect ophthalmoscopy. And after these tests, if there is any suspicion that exists or if some further more information is required from the eye, he may ask for a test called as OCT. That is where your inner retinal layer can be analyzed in micron resolution. Very fine diagnosis can be made. And he may even ask for a test called fluorescein angiography, wherein a dye is injected and photographs are taken of the eye to see how the blood vessels are behaving, how the leaks are happening, if at all there are any, and where the treatment is required. So this kind of an examination is required and is must to protect the eye from going blind. This is to be done when it is diagnosed at the first diagnosis. Later on, if everything is found fine, depending on the overall health of the eye, your doctor may suggest an annual eye examination or a 6-monthly eye examination based on the preliminary findings. Sometimes they may call even earlier. It is very important for the person to keep up these examination schedules and ensure that they visit and get the eye health evaluated at each time. What do doctors do when the person comes? And why should a person go to an eye doctor if his blood sugars are already under control? This is an important question. Having good control of blood sugars is important and it reduces the risk of eye damage. But these diabetic related eye damages are silent in the eye. When I say silent, they do not cause any pain, they do not cause any redness or watering or decreased vision in the initial stages to draw the attention of the person. What I mean is, even if the problem is brewing inside the eye towards blindness, the person may be totally unaware and being able to do all his day-to-day activities. So this is a silent disease and silent diseases are dangerous. That is why many people go blind, because the disease is silent. The person assumes that everything is good. Person just monitors his blood sugars and he is thinking all is fine. But suddenly a day he comes to know that the problems have been happening for months to years and a stage has reached where nothing much can be done. This is unfortunate, and all of us together should work towards this and ensure that all the diabetic patients have periodic eye checkups, periodic retinal examinations, even if their blood sugars are under control, even if their vision is good and they are able to do their day-to-day activities. It is these silent diseases which require widespread awareness and a proactive and very health conscious approach by the society in terms of coming to the doctor. What we see is initially people come regularly every year or 6 months once as is advised. After 4-5 visits, they assume that whenever I am going, doctor is saying things are fine. Then why should I go? Unnecessarily waste money. Is the doctor calling for making money? This kind of people are also there. What is told in their interest, also they are not able to digest. This kind of various approaches. So we should come out of all these things and make health a priority, understand the situation, follow the doctor's advice, and I am sure doctors do advise, at least majority of them, in your best interest. And it is very important for you to trust your doctor and have these tests done and protect your eyes. If a problem happens in the eye, what is the doctor going to do? Then you need to understand the entire problem. These days, a lot of digital images are possible, because when a doctor is talking about a problem that is happening inside the eye, from an external perspective, eye is looking normal. The person is not able to understand what is this internal thing doctor is talking about. So it is these situations that we take digital images of the internal parts of the eye, show it to the person and say this is how it should have been, but this is how it is. Called as what is called as fundus photos. This is how it is, and this is where the problems can come up. So an understanding of the patient and the family with respect to the condition of the eye is extremely important, and it will help the treating doctor do better treatment. And I must tell you good news, there are a lot of newer medications which are available, which are given in the form of injectables into the eye, which can help contain the problem that in the yesteryears, maybe 10 years back or 15 years back, it would have led to blindness. But in the current situation, by injecting those medicines called intravitreal injections, we can protect the vision, retain the vision, and to a great extent help the persons live with useful vision throughout their life. Many times multiple injections are required because it's nothing but a medicine. It doesn't last forever inside the eye. Some medicines last for 2-3 weeks, some medicines last for a few months. But if the problem persists or continues, then further injection, further medicine may have to be given. This is again another situation where we see many patients getting little frustrated or feeling bad that I have already taken 3 injections, why again? You take tablets every day and tablet effect doesn't last forever. Injection is nothing but a medicine. It doesn't last inside the eye forever. If the problem is contained with one injection, you are lucky. Generally, people require more than 2-3 injections. Some people have taken 15 to 20 injections or even more. But it is these guys, it is these patients who follow their doctor's advice, see the evidence, see the problem, see the benefit of the medicine, and once the benefit of the medicine goes off, ask for one more dose of medicine and maintain the vision. So, one is technology that's available, other side disease that is there, but an understanding of the utility and matching them and taking the doctor's advice and implementing is the responsibility of the people. In these directions, these newer medicines help a lot. Even there are lasers. Lasers have protected many eyes. It has prevented millions of people going blind. But laser cannot bring back the vision that is already lost in diabetes. I am talking of diabetic lasers. When we talk of lasers, there are multiple lasers that are available. I am talking of diabetes related laser. So laser treatment that is done is aimed at maintaining the situation and trying to, I am using the word again, trying to protect the vision that is there now. Many a times if the disease is advanced, or if other problems like cholesterol increase or creatinine going up, urea going up, and other bodily health deteriorating, then in spite of laser, sometimes vision is lost. But many a times, lasers will help in protecting the vision and many people have got benefit out of this. If all these things fail, there is a treatment called surgery, wherein doctor goes inside the eye and takes out all the blood that has leaked, and he seals the leaking blood vessels. But what doctor can't do is, the retina which has become weak, which has become unhealthy, which is non-functional, he can't make it function again. And hence, you should understand that prevention plays a huge role in protecting the eyes when it comes to diabetes. So, second sentence is, diabetic blindness is preventable provided you seek medical advice early, maintain good control of diabetes, and also take care of other comorbid health conditions. In very rare cases, in spite of all these things, due to optic nerve problems or due to other associated problems, people might have lost vision. But by and large, by having awareness about diabetes and what it can cause in the eye, by following all the medications and periodic preventive eye checkups, one can prevent diabetic blindness. Let us fight together to prevent diabetic blindness, and let us spread the happiness of good vision. Thank you.